Hi, I'm Shahid Islam, Senior Research Fellow in Act Early, which is a project within the Bradford Institute for Health Research, the same institute in which Born in Bradford is based. My research is all about co-production and citizen science, and how do we get our communities interested and involved in everything that we do as part of the work of the Institute. We're here today in Kalasangam in city centre of Bradford, just behind Broadway, and this is a Born in Bradford event. And the idea behind this event is mostly to sort of connect with our communities, but also to share some of the findings from our research. We've done a lot of work, we've had a lot of conversations recently with members of the public, and the conversations resulted in us knowing that a lot of people are very interested in the research we do and would want to create an informal conversation with us about what we found, how we do it, and also just learn a little bit about what Born in Bradford is. So for that reason, me and my colleagues from the Bradford Institute for Health Research have just turned up with some leaflets, paraphernalia, but mostly just ourselves, just to make ourselves available to the public. So Born in Bradford is what is known as a longitudinal birth cohort study. So it's probably just worth me explaining what that is. So longitudinal birth cohort studies recruit families at the point of birth or just before birth, and take as many details as they possibly can about the family, both mother, father and the unborn child. And then when the baby is born, they take as many details thereafter. And every now and again, usually every few years, a birth cohort study involves doing a sweep, which means going and finding out a little bit more about those children. The idea behind such a study is if you follow children for long enough and if you follow families for long enough, you'll be able to see patterns in their development, in their language, in their behaviour, in their health outcomes, and a whole host of other variables. So what we're doing as part of Born in Bradford is following those children to see and understand why some children do well, thrive, develop well, and meet all the milestones, and why others struggle. So that's essentially what Born in Bradford is. There are many longitudinal birth cohort studies spread across the world, and this one is based in Bradford, looking at the children who were born in Bradford. So Born in Bradford originally started in 2007, and that cohort carried on till 2011. So if your child was born in between those years in Bradford Royal Infirmary, there's a good chance you'd have been asked to sort of be recruited to that study. Since then, there have been a number of other studies which kind of do the same thing. So for example, B4B, which is looking at children who were born after that time frame. There's also Better Start, Bradford's innovation hub, looking at another cohort called Born in Bradford Better Start. They're born in the 3 wards of Little Horton, Bowling and Barker End and Bradford Moor. And that one started in 2016 and is still recruiting now. They've just reached 4,000 recruits to that one at the moment. The original cohort, the one in 2007 to 2011, had 13,500 families recruited to it, and that's the one that people recognise as the Pathfinder. That's the original one, and that's the one that gets the most recognition. So we're not just an academic institute which publishes academic papers. We do that, but that's not the prime purpose of why we exist. We consider ourselves an institute which is involved in applied research. In other words, the research that we do and the evidence that we produce should have a direct impact on the communities that the research relates to. So if we find out things which will be useful to communities, we need to find a way to share that with our communities. And communities, in turn, should also be interested in the kinds of things that we're finding out. So everything that Born in Bradford and the Institute are involved in is purely about making the city and the health of the residents of the city better. So this event that we've put on today is hopefully the first of many, and what we want to do is we want to create opportunities to have conversations with members of the public and the researchers who are involved in the research to understand what we're about and what we've learned. And also the other way around, we want to be hearing what people tell us so we can be inspired by that. So keep connected to that, and we're going to find innovative and creative ways of sharing information. For example, B4B TV will host some of the conversations between people like me and Dr. Sohail Ahmed, and the academics who are part of the Bradford Institute for Health Research, so we can break down exactly what we're doing and share it in a way which is meaningful and easy for people to absorb, rather than the kinds of things that we publish in scientific papers.